between 1950 and 1990, breast cancer mortality increased 4% per year. It reached a peak in 1991. Over the past 21 years, the mortality has declined 23%. So now there is not anyone in the world that quotes a cure rate less than 80% for breast cancer. Everyone believes at least every 4 out of 5 women with breast cancer are cured. So you have to look at rate of change in the world and take this in a broader perspective. So people look at what's known as knowledge doubling. So if you look at cancer, first chemotherapies were 1943, applied to children with the disease. When I went through medical school, it was not known what caused cancer. Then it was found out that it was alterations in the genes in the body, which was responsible for cancer. So the first genes were sequenced in the early 1980s. First targeted therapy was 1998. First sequencing of the genome was 2001. First immunotherapies were 2011. I just looked at a partial listing of FDA-approved targeted therapies. At the moment, there are at least 84. In 5 years, it is expected that there will be at least 50 immunotherapies. All a patient basically has to do is hang on, and this disease will be cured.
You know, it was fall of 2015, I started having some symptoms, and it was a really good year for me and my family otherwise. My wife and I, we had a daughter that summer, so I was a new father. And then as it continued to not get better, and they're like, oh, just give it time. Eventually, I insisted on an MRI, and when they did the MRI, I got one of those phone calls that nobody ever wants to get, where they said, you know, are you sitting down? In your back, that's cancer, and it's spreading from somewhere else. So they're like, this is a very big deal. You need to see someone right away. You know, when I first found out about this and I went in for diagnosis, you know, it was pretty grim. And they told me I had bile duct cancer, which is bad enough, but then they said it was stage 4, which is really bad. And yeah, it was not a great start on this journey, for sure.
But we sequenced his tumor, and we've sequenced his blood, and he had 2-3 obvious alterations. So we gave a combination of 1 chemotherapy and 1 targeted agent and 1 immunotherapy. And then we just gave that treatment over a period of time, and we watched the cancer cells in his blood progressively decline, and he has done phenomenally well. If there is one message here, if your doctor has not sequenced you, either ask him or her to sequence or find another doctor, because this is going to be the key to treating cancer in the future.